Good morning, everyone. Today we are going to see about the disease of skin. So before starting in this chapter, I would like all of you to know about the definitions of vesicle and bullae. So what do you mean by vesicle? It is a circumscribed collection of free fluid up to 0.5 centimeter in diameter. So bullae, it is same like vesicle, but there is a difference in the size. It is greater than 0.5 centimeter in diameter. Okay. And very first skin disease we are going to discuss is ectodermal dysplasia. So what do you mean by ectoderm? As you all know, it is a germ layer, right? So something dysplasia means it is different from the normal thing. So the structures derived from the ectoderm is going to be abnormal in this disease. So the structures, what are the structures which will derive from ectoderm is mainly the nails, hairs, skin, etc. Right? So this disease exhibits manifestation, abnormal manifestation in all these structures. Okay. So it is a large heterogeneous group of inherited disorders, and it affects more than one ectodermal derivatives like skin, hair, nails, eccrine glands, and teeth. Okay. And we can classify this into two. One is hypohidrotic ectodermal dysplasia and hidrotic ectodermal dysplasia. Look at this picture closely. What are the things you can observe from this picture? Just deeply watch this picture. You can see the eyebrows, hairline, right? And you can see the mouth profile, okay, everything. And here you can see dental, hair, and nail abnormalities. The number of hair follicles, sweat glands, and sebaceous gland, it varies. And there is hypoplasia of the salivary glands. Lacrimal glands may be deficient. So obviously, there will be a dryness of the mouth and the dryness of the eyes. And there is abnormal morphogenesis of the teeth. And the nails are thin and brittle in this disease. And when you take hypohidrotic, there will be the same thing, frontal bossing. And we can see, able to see from this picture, shrunken cheeks, saddle nose, and then look at the lips, it is thick and everted, and the skins are hyperpigmented around the eyes, and there is a low seat of ears also. Look at the teeth inside the mouth, it is conical or peg-shaped teeth, right? Now we are moving to the hidrotic ectodermal dysplasia, and here the clinical feature includes nail dystrophy associated with hair defects, palmoplantar dyskeratosis. The nails are thick and discolored. Scalp hairs are very sparse, fine and brittle. Eyebrows are thin, and you can see a normal faces over there in difference from the hypohidrotic ectodermal dysplasia. And the sweat glands are also not getting affected here. Okay, and there is no dental deficit also. And the histological findings. The skin histopathology, there is reduction in the number of sweat glands, hair follicles, sebaceous glands. The epidermis is very thin and flattened, and sweat glands are also very few, and they are rudimentary or poorly developed. There is no treatment, specific treatment for this disease. So now you can understand, I think, the ectodermal dysplasia and its pathophysiology, types, and the clinical features, right? Now we are moving to the next important disease is oral lichen planus. It is a common mucocutaneous disease, and it causes bilateral white striations, papules on the buccal mucosa, tongue, and gingiva. The association of lichen planus, diabetes mellitus, and vascular hypertension, and it is a triad, and it is named as Greenspan syndrome. This is very important. And day-to-day clinical practice, we can expect to see this kind of disease. Put the picture. what you can able to see is there is a white color discoloration seen over the buccal mucosa. So it appears a small angular flat top papules. Sometimes you can see the mixed red and white color, purple, or sometimes violaceous hue also you can see. And later on, there will be a pigmentation and it will change into brownish in color. Okay. The center of the papule may be slightly umbilicated. Surface is covered by fine grayish white lines, and it is called, as you all know, Mycum striae. And there are different forms. We have different clinical forms: bullous, erosive, atrophic, and hypertrophic. It depends all upon the clinical picture of the particular disease. Look at this. This is the bullous form, and you can see the bullous appearance of the lesion. Look at this erosive form, red color, irregular borders. This is erosive form. Now you can see the atrophic form, and this is the reticular form of the lichen planus. Oral manifestations in specific, we can see, as we have already discussed, the Mycum striae, radiating white or gray, velvety thread-like papules in a linear, angular, or retiform arrangement, forming typical lazy reticular patches, rings, and streaks over the buccal mucosa. This is the commonest manifestation, oral manifestation we can expect to see here. Lichen planus. You can also see over the lips, tongue, and palate the tiny white elevated dot present at the intersection of the white lines is known as striae of lichens. Now we are moving to the histological findings. What are the things we can expect to see here is your hyperkeratosis, basal cell degeneration, and there is a subepithelial band of lymphocytic infiltration. And look at the sawtooth red ridges, and there is a deeper connective tissue which is free of inflammation. So the differential diagnosis include lichenoid reaction, leukoplakia, candidiasis, pemphigus. We can see the detailed pathophysiology later on. The treatment includes the topical steroids, example, fusinonide, and the systemic administration of steroids. Now we are moving to the another interesting disease, psoriasis. As you all know, it is a non-contagious skin disorder. It appears as inflamed edematous skin lesion covered with a silvery white scale. And the most common area of presentation is scalp, trunk, and limbs. The nails may be pitted or thickened. Clinical features: small, sharply delineated, dry papules. They are covered by a delicate silvery scale. If the deep scale are removed, one or more tiny bleeding spots are disclosed, and this is called auspix sign. And it is painless but very pruritic, roughly symmetrical in nature. Oral manifestation: you just see the appearance of the gray or yellowish white plaque all over the mouth, the scaly lesion with an erythematous base. As multiple papular eruption happens, it might be ulcerated. And the histological findings: there will be a uniform parakeratosis, absence of stratum granulosum, elongation and clubbing of the red ridges. And here I want you to know about the Mandel's abscess. Okay. It's nothing but intraepithelial microabscess, small pustules. There will be tortuous dilated capillaries extending high in the papilla. Okay. The treatment includes UV light, retinoids, methotrexate, and cyclosporine. Erythema multiforme, it is an acute self-limiting dermatitis characterized by a distinctive clinical eruption manifested as the iris or target lesion. Etiology includes drugs, infectious agents, HSV infection. Clinical feature, erythematous discrete macules, papules, or occasionally vesicles and bullae are seen. Is symmetrical in nature, and commonest area are hands, arms, feet, and legs, face, neck. The concentric ring-like appearance of the lesions give rise to a target iris or bull's eye appearance. It is called Stevens-Johnson's curve. It is a severe form of erythema multiforme. And the mucous membrane lesion includes the vesicle and bullae, which ruptures, ulcer, which will be having a white or yellow X-ray coverage. And it is extremely severe and so painful. Eye lesions, photophobia, conjunctivitis, and corneal ulceration. Genital lesion includes non-specific urethritis, balanitis, vaginal ulceration. Histological findings includes there will be a intraapical vesicle formation, dilation of the superficial capillaries and lymphatic vessels in the connective tissue, and you can expect to see a varying degree of inflammatory cell infiltration. Differential diagnosis, any kind of vesicular-bullous lesions, you can give chickenpox, herpes zoster, lichen planus, familius, and after stomatitis. And the another severe form is fatal form of this disease manifestations is toxic epidermal necrolysis. It is very much fatal, bulbous drug eruption, so severe. There will be a peeling of large sheets of skin and giving the appearance of a widespread scalding burn. So obviously there will be secondary infection and finally leads to death. Treatment includes antihistamines, analgesics, local skin care, and soothing mouthwashes. So next class we will continue the remaining diseases of the skin. Thank you.